Hello. After examination of the patient, we need to take the first conclusion for the manage, and we need to answer the question, is this child seriously ill? Recognizing the need for prompt help is a central skill of pediatrics. Watch and learn from an experienced pediatrician in action. Check the ABC of emergency. A for airway, B for breathing, C for the circulation, then inverse traffic light assessment. The green zone. Can the child take most feeds okay? Has he a normal color of lips, tongue, skin? Do he respond to social cues? Alert or wakens quickly? Has he a lusty cry? Or playing? Breathing calmly or not? The orange zone. Taking 50% of feeds. Pale. Not responding to social cues. Hard to wake. Less activity. No smiling. Tachypnea. Saturation of oxygen SO2 less than 95%. Crepitations. Nasal flaring if less than 1 year. Capillary refill time greater than 3 seconds. Don't rely on BP. The red zone. Pale, mottled, ashen, blue. Doesn't stay awake when roused. Consciousness. Not engaging. Apathy. Coma. Skin turgor. Any grunting signs? Grunting signs. Weak or continuous high-pitched cry. Tachypnea. Rib recession. Retraction of sternomastoid. Nasal flaring. Wheeze. Stridor. Unequal or unresponsive pupils. Focal CNS signs. Fits. Marked hypertonia. Not using limbs. Lying still. Odd or rigid posture. Decorticate. Flexed arms, extended legs, or decerebrate arms and legs extended. Temperature 38 degrees if less than 6 months or 39 degrees especially if cold or shut down peripheries. I have a bad feeling about this baby. Learn to trust your judgment. Neck rigidity, non-blanching rash, meningism, bulging fontanelle, etc. Green bile in vomit, Grell intestinal obstruction, for example atresia, volvulus intussusception. When assessing response level, use AVPU. A for alert, V for response to voice, P for response to pain, U for unresponsive. The most causes at emergency are sepsis, meningitis, seizures, diarrhea and vomiting in gastroenteritis, viremia, obstruction, example volvulus, food protein-induced enterocolitis syndrome, diabetic ketoacidosis, hypoglycemia, U&E imbalance, myocarditis, congenital heart dis, cardiomyopathies, intussusception, arrhythmias, disseminated intravascular coagulation, hemolytic uremic sin, Reyes syndrome, metabolic errors. This table shows the heart rate and respiratory rate values according to age. Beware an inappropriately normal heart rate or respiratory rate in a tiring and peri-arrest child. Now is time of action. Manage A, then B, before moving on to C. Call for help. Basic life support. Establish an airway. Use 100% oxygen. Use jaw lift if necessary. Suction nasopharynx and mouth is needed. Provide oral or nasopharyngeal airway. Do not force a distressed patient to lie down. Identify level of respiratory severity and if resuscitation is needed by, for example, the bronchodilators for acute severe asthma. Work of breathing can be assisted by non-invasive ventilatory support. Start pulse oximetry and cardiac monitoring. Establish IV access. Have a low threshold for intraosseous access if IV access is difficult. Take relevant bloods. Provide IV fluids, 20 ml per kilogram normal saline if volume depleted. Review and repeat until clinical improvement occurs. Early involvement of seniors is imperative. If no response to initial fluid bolus, get specialist help. Inotropes may be required. And you should treat the cause. If you have any questions, let me know in the comments. If you like this video, please share and subscribe. If you missed the precedent videos, check the playlist of USMLE. Thank you for watching.